Hello again, my name's David Holden, naturopath and biochemist, and I want to talk today about Breast Cancer Awareness Month and the specials that we're offering for female patients. If you've had a family history of breast cancer or you know someone close who has had a scrape with breast cancer, you'll know how disturbing and alarming a diagnosis of breast cancer really is. We understand this condition very well. Despite me being a mere male, I understand the distress it causes women. Breast cancer is now the leading female cancer in the world. A third of all cancers worldwide are breast cancer. So you have a right to be concerned, and there's a lot of things you can do to be proactive to reduce your chances of getting breast cancer significantly. And we're going to go through those in a wellness special we're offering for $99. So that involves an hour consultation with me, which is heavily discounted. You're saving $125. And what I do in that consult, we email you out 2 questionnaires, one called the HAQ, which is a health appraisal questionnaire, which is very detailed. And I analyze that and graph it and show you what it tells me about your health and what things that come up as red flags and what you can do to prevent them from becoming health issues as you get older. We also do analyze your diet in detail, and we scan you with this scanner here, the S3. And the S3 scanner is a high-tech device from the United States that tells us what your circulating antioxidant levels are in your bloodstream. The higher the levels, the lower your risk of any type of cancer. And we go through particular lifestyle factors, like for women and men too, avoiding using aluminium antiperspirants and aluminium containing deodorants. Read labels. All the common brands heavily marketed on television have 30 to 35% aluminium salts in them, and that goes through your sweaty armpit into the breast ducts and blocks them, and is one of multiple causes of breast cancer. So my advice: use a herbal deodorant, chuck out your aluminium containing ones. If you have to use an antiperspirant, if you're wearing an evening dress to a function, once off, not a big deal, but not for everyday use. Another tip, free tip for you. If you're a woman with larger breasts, it's uncomfortable not to wear an underwire, but it's important not to wear an underwire bra for periods of time during the weekends, when you're not at work, when you don't have to look so glamorous, not trying to impress your husband or your boyfriend or yourself. So the breasts are designed to move, to pump lymphatic toxins out of the breast ducts. When you have an underwire, it cuts off the circulation and clamps the breast firmly on the chest so they can't move. And this is not a good idea. It's okay for, use when you need to have a nice cleavage or whatever, but the rest of the time, if you can go without a bra or wear a sports bra that has no underwire, that would be my recommendation, as much as you can comfortably. Obviously, if you're a D cup or bigger, that's pretty impractical, but at least try it for some of the day, and certainly never sleep with a bra on. I don't know any women that do, but some probably do. So little tips like that can make a big difference. Lifestyle, we look at helping you get your weight to within 10% of your BMI safely and scientifically with a technique that works. And we've got proven results with this over many years. We look at how you can exercise for maximum efficiency using HIIT, and I give you references, I show you YouTube clips, and we support you, hold your hand through these lifestyle changes. It's not all about taking pills. It's about your lifestyle, what you eat, what you think, what you drink, how often you drink it, and also what you absorb is a big part of what's going on with all types of cancers, because cancer is a lifestyle disease for the most part. So we cover all these things in an hour consult, just to give you an introduction to where you can go to reduce your breast cancer risk. If we pick up signs that show more testing is needed, then we would recommend that in a follow-up, but that's only if the original tests we do, like the scanner here and the HAQ, pick up some red flags. So That's all I wanted to talk about for this little video clip, to give you an introduction on what we do to help with breast cancer awareness. And there's a lot that can be done even if you've been diagnosed with breast cancer, there's heaps we can do to reduce the side effects of drug medications you're on, increase your longevity, increase your happiness coefficient, and also increase your energy and stamina levels. So those are all really worthwhile things to do. And in many cases, we do help with the remission of the disease. And that takes a lot more work. Obviously, the further down the track the person is with a cancer diagnosis, the harder work it is to pull it back. Not always possible, but certainly we can improve the length and quality of life, and that's a big, big plus. So thanks for listening.